Well, hello. I'm here to talk about something that's been very popular for a long time, and what I really want to do is just maybe clarify a few things and then admit that there's a lot of things that are less than clear. I'm Dr. Ned Rupp. I absolutely love working with food allergy and intolerances, and it's fascinating. A lot of research that we're doing is leading us to new treatments and understanding of many things about foods. But there's a lot of things that are oftentimes very hard to understand, and a lot of symptoms that people can have that are also hard to understand exactly what's causing it. So, the whole idea of celiac, I want to just present in a very simple manner. Celiac disease is a very potentially severe disease. It's fairly uncommon, probably 1% or less of the population has it. And with good techniques of being able to identify and make the diagnosis, it is diagnosable. And when it's found, it's a clear gluten problem. It's not just an intolerance, it's actually has to be eliminated totally because the small intestine is being inflamed and broken down, and then that leads to problems with malabsorption and risks for other kinds of intestinal disease and even cancer. So consequently, it's a very severe disease. It's not too common, but it has to be ruled out when people have ongoing problems with their gastrointestinal tract. Over and against that is allergy, which is not to gluten. That is a different antibody. It's from the IgA class. Whereas allergy to grains, especially wheat, rye, or barley, all of which contain gluten, are also found. They're not common, but they're certainly more common than gluten enteropathy or celiac disease. And those are screened for very easily by either the classic scratch tests that we do for allergy to environmental allergens or to other foods as well, or they can be done by the serum or the blood tests that are utilized also for looking at allergies. When there's an allergy, then we typically also eliminate the food. And so if you were wheat allergic, we would eliminate wheat, but we wouldn't necessarily eliminate oat or rye if you were negative to those, because although they contain gluten, they don't contain the specific wheat allergen. So it would mean you're not gluten sensitive, you're wheat allergic. So consequently, that's a difference between the two. You would eliminate all three grains if you were gluten intolerant because you had celiac disease, but you would only eliminate the grain you were allergic to in pure grain allergy. The third problem oftentimes is, and the most common one I believe, is a form of intolerance. And intolerance really means I'm eating foods and they're causing me to have a lot of GI symptoms, and these can be very varied, such as being gassy, bloating, having differences in stool patterns, more reflux, but all kinds of things. And again, if gluten is suspected of being a problem, then your three major grains that we've mentioned over and over again, wheat, rye, and barley, would contain that gluten. And a reduction in intake may start to bring about changes in how you feel and how you're doing, and a decrease in the symptoms. It doesn't have to be an all or nothing approach, because the small intestine would not be attacked or damaged like it can be and in allergy, and certainly would be in gluten enteropathy or celiac disease. And I use those interchangeably because you'll hear both of those when referring to the severe disease that's called gluten enteropathy or celiac, okay? Finally, with any kind of gastrointestinal symptomatology, it's very important to realize we don't want to go to strict avoidance patterns when we're eliminating foods that are very healthy. And whole grains always are a clear part of a normal and healthy diet, except in certain very problematic circumstances. And again, for people who are trying to be gluten avoidant, remember rice and corn and typically oat, potato, there's a lot of other options that are still in that used for grains, breads, and other kinds of foods that do not need to be eliminated. So even if you're trying to avoid gluten, make sure you know what you don't need to avoid, and don't take away from the enjoyment of eating, which is so much a part of a good thing in life and also a good place for socialization. So what my main purpose is in doing this is just trying to add a little bit of, here's kind of an overview of kind of 3 different approaches. There are many other kinds of food allergy to different foods. There's many other kinds of intolerances. And again, those are oftentimes reviewed or looked at when we do an evaluation, which if you're having that problem, I'd love to work with you on that. But things like lactose intolerance and sulfite sensitivity are other things that from a dietary standpoint can come to play with causing people to have symptomatology that is uncomfortable, that's disturbing to them, and that can oftentimes be benefited from. A final thing is for myself, I've found that I enjoy eating, and I don't want to keep people from one of the great enjoyments of life, as long as it's in their best interest and done in a way that's healthy, and yet at the same time where it's practical as much as possible. And when the fear of eating can be taken away, that's really important from a psychological aspect, so that it is a time of enjoyment and a time of socialization for all of us. So if I can be of help to you at any time, that's great. I'd love to do that. But I wanted to give this little summary of just the basics of the 3 issues that we oftentimes look at, which is celiac disease, grain allergy, particularly wheat, barley, or rye, since those are the 3 gluten-containing grains, although you can be allergic to any grain. And then thirdly, gluten intolerance, which is far less severe probably than the first 2, and oftentimes can be by adjusting the diet to less gluten intake. Thanks for giving me the chance to talk to you today.